Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
Hello everyone, I'm Aditi Gangal from THIP Media and today's health file is on menopause. Today, we have invited Dr. Sushma Deshmukh, an experienced gynecologist, and the women to open first menopause center in Nagpur. This menopause clinic will focus on physical, psychological, hormonal health, as well as post-menopause issues like obesity, fragile bones, breast, and cervix cancer. Dr. Deshmukh will focus on how different cultural and social aspects of life affects menopause in women. Dr. Deshmukh has helped many women with menopause and now wants to explore how our beliefs and traditions affect it. So let's learn from her how we can understand and manage menopause better, considering our cultural backgrounds. Hello, Dr. Deshmukh. I welcome you on THIP Media's show Health Files. Uh, Ma'am, I'm happy to have you here. Hope you are feeling the same.
Thank you.
So,
Thank you very much.
Ma'am, let's begin. Dr. Deshmukh, please tell us from your experience, has the perception of menopause changed over the years in India?
Yeah, it's a really very good question. See, basically, if you would like to know, basically, I'm an infertility person. I'm having my IVF center, but I'm interested in a lot of public awareness programs. Since adolescent to menopause, I'm having different programs in my hospital. So that's why I have started this menopausal clinic with some doctor friends. Okay, Dr. Kanchan Soti is with me. So this is a wonderful clinic. Along with other gynecologists are there, like Dr. Kothari is there, and some supportive doctors are there. Like someone is working in endocrinology, someone working in the this counseling. Counseling, Mrs. Sathe is with me. So this is a combined approach. Why this is important? ये important क्यों है? अभी आप देखते हैं तो life expectancy of the menopause of the female is around 73 years. Life expectancy of Indian woman is 73 years because of so many things are there. Like कैसा है कि she has become alert, aware about so many things. So बहुत सारा डॉक्टर्स की तरफ जाकर पूरा अपना चेकअप कराते हैं. Even she is aware of so many problems that is happening. So that's even the advances, medical advances, diagnostic techniques, management, treatment patterns. So because of this, overall life expectancy is increased. So if you see, our clinic is 40 plus clinic, and what we have seen, the normal menopause time in Indian woman, it is around, we say, the 46.2 years. That means in the strictly, if you conduct a study, it is around 41 to 49 years. The maximum, this is in the menopause time of Indian woman. Okay, and expectancy is 73 years. So 1/3 of life they are having this phase. They are spending in this phase, which is very important. See, at the age of 40, the women already, most of the time, they are nowadays they are doing career, or even if they are not doing, they are many times financially settled, even though their maturity, mental maturity is more. So they are knowing what is good, what is bad. So that's why we call it as a very pragalbha, that they become very much mature about so many things. They are knowing now, knowledgeable also. And with this phase, this is very important phase, 40 plus, and they are spending most of the time in this around say 33 years in this phase. So it is very important that they should think about themselves. So what we have observed, this question is as a perception of menopause change. There's a lot of change. The women, especially the urban women, they are becoming alert. Even if you have noticed your senior friends or your relatives, they all became alert about their dressings, about their extracurricular activities. Even if you see the WhatsApp videos, see how the 50 plus, 40 plus, their women they started enjoying, they are learning so many things. So this percentage is increasing nowadays because of the, maybe the credit goes to the advances, medical advances, then the education, and then they are started thinking about themselves. So definitely they are now, what we always tell, even we talk to our patient, aging gracefully, which is very important thing. See, they should not have, there are so many things are there, mental depression, so many things, but if you think it positively. So nowadays women are thinking in the same way, and we are making them to think like that, do to be positive in their life.
Yes, ma'am. So as you have emphasized on positive thinking, ये बहुत जरूरी है. So मैम आप
Yes.
थोड़ा सा हमें challenges के बारे में भी बताइए कि current challenges क्या हैं around menopause. Probably what are the challenges you often see among your patients
See,
with
there
menopause?
are many, see, menopause is that way challenging phase. See, what is important, what is menopause actually? If the woman is not getting her menstrual cycle for 1 year, that is 12 months. Very simple. And generally, just I am taking you back to the menarche also. है menarche जब periods चालू हो जाता है, around it is now the age has reduced like 10 to 11 to 14, like. See, that time also the estrogen, estrogen is the main female hormone. It is the main hormone responsible for all the things. It is responsible for all the feminine things, menstrual cycle and everything. Okay. So it comes in a female's life in a very stormy way. You can notice the adolescent girls, and also goes from the female body in a stormy way. So that's why it creates so many challenges. There are most other health challenges. These are early challenges and the late challenges. What are early challenges? Early challenges are suddenly the patient is feeling hot flashes. Okay. Then suddenly she feels like a sweating, palpitations. And so many things are there, like mental irritability. Many times she doesn't understand what is happening in her body. Even though there is a AC is going on, she feels very sweaty, very disturbed. So these are very, and she is many times unable to cope up with these challenges. She should understand what the problems are there and how she can cope up with all this. Then the other challenges, see, 40 plus, what's the purpose of 40 plus women making them aware? Because this is a very important age. We call it as a high risk age category. Why? Because this menopausal changes, along with that, she will get other medical problems like hypertension, diabetes, then the heart problems, and even the bones, which is very important because this estrogen hormone is a bone protective. Remember, it has it gives effect of all the feminine characters as well as, see, the luster of skin, hairs. So it is and the glamorous looks and everything because of this estrogen hormone. But along with that, it has very important changes on the heart and brain. That's why if you observe, कैसा होता है कि मैक्सिमम जो वुमेन को जो प्रॉब्लम्स आते हैं, जैसा बैक एक इज वेरी कॉमन आफ्टर मेनोपॉज. इवन हार्ट डिसीजेस, ये भी मेनोपॉज के बाद में ही ज्यादा आते हैं. दीज आर द लेट चेंजेस. So what we always say that you have to be very more careful about all these things, and these challenges we need to explain them so that how they can cope up with all these things.
Okay. So मैम अगर सोशल एंड कल्चरल एस्पेक्ट से इस क्वेश्चन को हम देखें तो क्या मिसकंसेप्शंस हैं मेनोपॉज को लेके, like
See,
does these challenges include
if you see the social, see, there's a gross difference between the understanding of the social challenges, then the regional challenges, then the urban, rural, then it comes of families, a nuclear family or joint family. So many things we can tabulate in a good way. There's a very good study in 2016 by Sisendran, and he conducted a very large study, randomized trial control study amongst the various states of India. So what is absolute highest natural menopause in the Karnataka and the lowest in Kerala? So again, what there are other studies also, and this study also they supported that there are changes. Suppose the this patient, unmarried woman, widow, single woman, they are having natural menopause is less commonly. That means the percentage of this having the more menopause is more, and as compared to the other women who having the parasitism, having the more babies, okay, more children. Again, the another aspect is there's a mental makeup. If the lady is staying in the joint family, definitely there are so many things that distract her. Even there are so many things are going in the family. बहुत सारा cultural चीजें रहती है. So important is our festivals. Now the festival time is increasing. Now the festivals has started in India. So this has having a very good impact on this menopausal status. See, there are so many things that our culture has taught us. कि भगवान की पूजा करो, okay, then meditation करो. These are very good cultural aspect. दूसरा है कोई त्योहार आया है, तुम ये करो, वो करना चाहिए, पूजा करो, कुछ अलग चीजें बनाओ, रिलेटिव्स को बुला लो, सब उनके तरफ चले जाओ. These are the things. It has a very great impact on her menopausal status and the mental health. See, what is more important apart from all these body changes? Mental health is very important. And सपोज एक साथ में रहते हैं, 2-3 लेडीज और साथ में है, तो कैसा है, थोड़ा सा डाइल्यूट हो जाता है चीजें. इफ दे आर हैविंग सम फंक्शंस और द कल्चरल फेस्टिवल्स, अगेन द मेंटल हेल्थ इज मोर अच्छी है ये लोगों के इसमें एज कंपेयर टू दोज लेडीज हु आर स्टेइंग लोनली. बिकॉज अभी ये प्रॉब्लम बहुत ज्यादा आ रहा है कि जैसे आपने बोला है कि क्या प्रॉब्लम्स आते वेरिएशंस. नाउडेज कैसा है, न्यूक्लियर फैमिली आर इंक्रीजिंग. सबको लगता है हाँ हमको मालूम है सब, लेकिन क्या हो रहा है अपने इसमें, बच्चे बड़े हो रहे हैं. आफ्टर 40 years दे आर लिविंग देयर हाउस फॉर एजुकेशन, फॉर करियर एंड सो मेनी थिंग्स. हस्बैंड भी उनके उस पे ऊपर चले जाते हैं. ओके, तो घर में कौन है, मे बी हाउस वाइफ, करियर भी दोनों है, लेकिन आफ्टर रिटायरमेंट और ये, सपोज यू डोंट हैव, यू आर इन्वॉल्व इन एनी अदर एक्टिविटीज, सो डेफिनेटली यू आर अलोन इन दैट हाउस. तो दिस इज अ एम्प्टी होम सिंड्रोम. This is becoming more common in these females. सभी है तुम्हारे पास में, तुम सब कुछ कर सकते हैं, but still mental stability is not there. फिर ज्यादा सिम्टम्स, सभी सिम्टम्स ज्यादा लगते हैं. सो कल्चरल, सोशल, इकोनॉमिक का बहुत बड़ा इम्पैक्ट है इस चीज के ऊपर, वुमेन के ऊपर.
Okay, so ma'am, like coming back to questions, क्या general misconceptions आप देखते हैं अपने patients में, कुछ ऐसा
Yes,
कुछ myth and misconception?
Yeah, sorry, we are diverted from the questions. But basically misconception ऐसे है, because it's a very vast topic, you know, you can just interrupt me if I'm going away from the topic.
No problem, ma'am.
So what is there? See, misconception कैसा है कि बहुत बार पेशेंट को प्रॉब्लम्स आते हैं. ये तो कैसा होता है कि कोई किसी को, जनरली क्या होता है, कोई फ्रेंड को पूछता है, इवन रूरल एरिया में भी मेरे पास हमारे तरफ से सभी एरिया के पेशेंट आते हैं, तो हाँ ये तो होते ही रहता है, डोंट बॉदर अबाउट इट, ये तो होते ही रहता है. Suppose what is more common in such patients, abnormal bleeding is very common because of the hormonal disturbances. और दे बहुत बार वो डॉक्टर की तरफ जाती नहीं कि ठीक है ये तो चलते हैं. फॉर एग्जाम्पल मिसकंसेप्शन, हाँ ये तो ये एज में होते रहता है, नॉट टू वरी. तो इसमें क्या होता है कि 10% दे आर हैविंग द प्रॉब्लम, लाइक they can have the serious problems, like because I already mentioned it's a high risk age. There can be a cancerous problems, there can be other reasons, there can be some polyps, myoma, these fibroids in the uterus. So we need to evaluate. So misconceptions are not to go to the doctor, it is happening like this. So these are a misconception. Diet के बारे में misconceptions है बहुत सारी. इवन डॉक्टर की तरफ जाना, बहुत सारे पेशेंट्स इवन अर्बन एरिया में बोलते हैं, मैडम अभी तो हो गया ना, बच्चे हो गए सब, अभी क्या जाना है चेकअप के लिए. तो जरूरत नहीं, ठीक है हो जाएगा, we'll just see what happens. So ऐसा नहीं है कि तुमको जाना चाहिए बराबर से, कि ऐसा नहीं कि ओनली चाइल्ड बेयरिंग के लिए पर्पस के लिए बॉडी. you need to understand simple breast examination, it is very important. We always tell the patient it should be a complete body examination. तो ये हेल्थ के बारे में अभी भी, आज भी इंडिया में बहुत सारी, दे आर वेरी कैजुअल अबाउट हेल्थ. जैसे वेस्टर्न कंट्रीज में देखते हैं 30 के बाद में दे स्टार्ट डूइंग पैप स्मीयर, सो मेनी टेस्ट, जनरल हेल्थ एग्जामिनेशन। हमारे यहाँ पे एटलीस्ट हम बोलते हैं एटलीस्ट 40+ के बाद तो करो आप, साल में एक बार जांच करो। कितने वुमेन करते हैं एक साल में? साल में डॉक्टर की तरफ कितने जाते हैं, कितने परसेंटेज जाते हैं? कुछ हुआ तो ही जाते हैं, अदरवाइज रेगुलरली नाउडेज कोई पेशेंट ही थोड़े थोड़े धीरे धीरे बढ़ रहे हैं अभी काउंसलिंग के हिसाब से, लेकिन बहुत कम जाते हैं कि हाँ अभी नहीं जाना है चेकअप के लिए, अभी एक सिंपल सोनोग्राफी करा लो। तो सो मेनी मिसकंसेप्शन देर की क्या जरूरत है इस चीज की? तो ये अपने को वो दूर करना है कि नहीं, यू हैव टू डू इट। और रूरल में तो बिल्कुल ही नहीं जाते, आते ही नहीं कभी। अर्बन एटलीस्ट बिकॉज ऑफ एजुकेशन दे आर कमिंग, बट रूरल में रूटीन चेकअप के लिए नहीं आते कभी कि चलो जाकर चेकअप करें अपन। अगर इवन प्रॉब्लम्स है तो भी वो टॉलरेट करते हैं कि चलो बाद में जाएंगे। बहुत सारे मिसकंसेप्शन है मेनोपॉज के बारे में। अभी तो चला गया होगा, बाद में भी समझो मेनोपॉज के बाद में ब्लीडिंग होता है, पोस्ट मेनोपॉजल ब्लीडिंग, तभी भी ध्यान नहीं देते। दे बिकम वेरी सीरियस प्रॉब्लम इफ यू if you are not considering this problem. This is a post menopausal bleeding. After menopause अगर bleeding होता है तो it's also major concern. तो ये सभी misconceptions हैं कि still they are not so serious about these menopausal things.
मैम ये तो है, लाइक नेग्लिजेंस इज एक्चुअली वन ऑफ द बिगेस्ट मिसकंसेप्शंस। सो मैम अभी आपने बताया कि कल्चरल एस्पेक्ट एक बड़ा मेजर इशू है जो मीनोपॉज को इम्पैक्ट करता है। सो मैम थोड़ा सा हमें बताइए that does this cultural aspect affect behavior of women regarding asking for guidance, like proper medical attention for her, like for their menopausal symptoms?
डेफिनेटली क्या होता है, अगर घर में कल्चर यानी कैसा है, व्हाट डू यू मीन बाय कल्चर? कि एक प्रकार का हर एक घर में एक कल्चर रहता है, पैटर्न रहता है, लिविंग स्टैंडर्ड कि इस प्रकार से उसमें एजुकेशन को बहुत इम्पोर्टेंस है। जैसे घर में एजुकेटेड मदर इन लॉ है, घर में एजुकेटेड कोई है तो दे बोलेंगे नहीं, चले जाओ एक बार डॉक्टर की तरफ दिखा दो क्या प्रॉब्लम है। कोई रहते तो क्या बोलते हैं, हमें भी ऐसे ही प्रॉब्लम थे, कुछ नहीं होता, हो जाएगा। सो दीज आर द कल्चरल डिफरेंसेस बिकॉज इन इंडिया, इन इवन वन रीजन द कल्चर चेंजेस फ्रॉम गांव टू गांव, कल्चर चेंज होता है, सिटी टू सिटी कल्चर चेंज होता है। इतने सारे लैंग्वेजेस है, इतने सारे कल्चर्स है, इतने सारे, तो वी कैनॉट, इट्स वेरी डिफिकल्ट थिंग कि टू अकोमोडेट इन वन ढांचा अपने इसमें नहीं कर सकते। तो सबसे इम्पोर्टेंट एक ही डिफाइन करो, एजुकेटेड, नॉन एजुकेटेड, अर्बन एंड रूरल। ये सबसे अच्छा है मेडिकल पॉइंट ऑफ व्यू, बिकॉज कल्चरल टैबूज रहते हैं कि नहीं जाना है डॉक्टर की तरफ, या अपने को इस चीज में जरूरत नहीं है। तो ये सब जो चीजें हैं, तो इट मैटर्स अ लॉट इन व्हेन वी आर डीलिंग विद द मेडिकल प्रॉब्लम्स। तो उनको काउंसलिंग की बहुत जरूरत रहती है कि नहीं। तो इसमें हम बहुत अपन आगे बोलेंगे इसके बारे में।
ओके, सो मैम लाइक थोड़ा सा आप सोशल स्टिग्मा के बारे में भी बताइए कि क्या आज की डेट में सोशल स्टिग्मा है जो प्रिवेंट करता है औरतों को अपने मीनोपॉजल सिम्टम्स का ट्रीटमेंट, प्रॉपर ट्रीटमेंट लेने के लिए?
Definitely, there is a still social stigma is there. Nowadays in urban area, a lot of women they are coming for medical advice, but still in rural, if you see the rural, and even in some percentage of women in urban area, even we have seen simple breast lump आ रहा है, they don't bother also, ठीक है, कुछ यहाँ कहीं तो भी दिखाएंगे या नहीं भी दिखाएंगे। अदरवाइज कुछ वुमेन इवन दो एजुकेटेड, व्हाट शी सेड फ्यू डेज बैक, नहीं कुछ तो भी निकल जाता है इसलिए जाना ही नहीं डॉक्टर की तरफ, फिर कुछ तो भी और जांच बताएंगे, फिर सोनोग्राफी करेंगे, सो अननेसरी कॉस्टली हो जाता है तो नहीं जाना है। और क्या जरूरत है, उनको लगता है कि क्या जरूरत है हेल्थ के लिए, अगर तकलीफ हुई तो चले जाएंगे, क्या जरूरत है, क्यों इतनी महंगी जांचें कराना है? सी मैं उनको क्या बताती हूँ, ठीक है सोनोग्राफी आपको कॉस्टली लगती है, चेकअप तो करवा लो, ओके सिंपल पैप्समियर टेस्ट कि नीचे से कैसा दिखे, क्योंकि देखो ऊपर से इट इज नॉट लाइक अ फीवर और तुम ऐसा खांसी आ रही ऐसा नहीं, तुमको जांच करना पड़ता है सर, प्रॉपर गायनिक एग्जामिनेशन शुड बी देयर। दूसरी बात है सोनोग्राफी, हम बहुत बार त्योहार में कपड़े खरीदते हैं, साड़ी खरीदते हैं, तब हम सोचते हैं कभी ऊपर नीचे, तो साल में एक बार एक सोनोग्राफी नहीं करा सकते? साल में एक बार अपना चेकअप नहीं करा सकते. सो ये कल्चर जो अपना है उसमें से थोड़ा अपने को डाइवर्ट होना है. वी आर okay with all festivals, pujas, सत्यनारायण, so many things we are spending. किसी को देना है, कुछ करना है, लेकिन why not serious about our health? तो इसमें से अभी भी बाहर निकलना चाहिए. अभी भी वुमेन बाहर उससे नहीं निकल पाती है. आज भी त्योहार में ही ज्यादा इन्वॉल्व रहती है. ठीक है, अच्छी बात है, त्योहार करो, पूजा पाठ करो, सब चीजें करो. That is our Indian culture, this is our ancient Indian culture that is important for mental health, very important. But think about in a positive for your routine health also, routine medical checkup. So that message always I would like to give.
Okay, ma'am, that's quite informative. So, ma'am, now coming to like the treatment of menopausal symptoms. हम सबको पता है कि hormonal replacement therapy डॉक्टर्स prescribe करते हैं generally उन cases में जहाँ औरतें severe menopausal symptoms face कर रही हैं and unbearable है condition. So, like, what are your thoughts on HRT? Because why I'm asking this, because currently it is a subject of debate. Like,
Yes.
there's a huge ongoing debate going on this.
We'll go to the yes.
Yes, ma'am. So, like, what are your thoughts on HRT and how do you guide your patients who may be considering this treatment option?
Okay. Before HRT, I would like to tell you something. See, when we consider a patient as a management, what we are doing, I will tell you. What we are having a forms, special forms. That is also designed by our clinic with guidance from our Indian Menopause Society. Okay. So we are designed forms according to our need, referring to this our Indian Society, Medical Menopause Society form. So in that we include every 40 plus woman who is entering in our hospital, just from the name, age, then the occupation, everything we write it down. After that, the routine examination, everything. Then special leading questions. What are her problems? Firstly, what problems she is having, and the other leading questions are what, except other than this, that we are expecting. So these are the questionnaires we put in front of them, and she has to tick mark all these questions. So what we have observed? What is more common? Mental disturbances are very common. So mental health is very problem. See, irritability, depressions, then empty home syndrome. So many. और क्या होता है फैमिली में कि कोई ध्यान नहीं देता है, क्योंकि ऑलरेडी जस्ट उनके बच्चे पढ़ने चले जाते हैं या घर में है तो बड़े हैं, उनका अलग वर्ल्ड होता है. मम्मी को आजकल पता नहीं क्या हो रहा है, मम्मी बहुत चिड़चिड़ करती है. हस्बैंड भी बोलते तुम्हारा तो रूटीन ही है, हमेशा कुछ भी हुआ तो चिढ़ना होता है, तुम इरिटेबल रहती है, तुम्हारा ध्यान नहीं रहता है. 4 भी लोग आए तो तुमको डिप्रेशन आता है, कोई किसी को कुछ बनाना है तो. सो नोबडी अंडरस्टैंड शी इज गोइंग इन दैट फेज. तो मैनेजमेंट पॉइंट हम डिसाइड करते उसको क्या क्या प्रॉब्लम्स है, व्हाट आर हर नीड्स. सभी पेशेंट को एचआरटी नहीं लगती है, हार्डली वेरी मिनिमल पेशेंट्स विल नीड एचआरटी. सो क्या करते हैं मैनेजमेंट, ये पूरे क्वेश्चन रहते हैं, इन्वेस्टिगेशंस रहते हैं. उनको कुछ अदर मेडिकल प्रॉब्लम्स है क्या, जैसे मैंने वाला उनको कई लोगों को हाइपरटेंशन, डायबिटीज या अदर प्रॉब्लम्स रहते हैं. तो ये सब वी हैव टू इवैल्यूएट की व्हाट प्रॉब्लम शी इज करंटली हैविंग मेडिकल प्रॉब्लम एंड व्हाट प्रॉब्लम शी इज हैविंग एंड किसके लिए उनको चाहिए. इसमें कैसा है, कोई लोगों को कुछ अर्ली मेनोपॉज जैसे है 40 टू 50 के बीच में सेक्सुअल प्रॉब्लम्स भी आते हैं. इवन मेनोपॉज अर्ली हो गया तो यूरोजेनेटल प्रॉब्लम्स आते हैं. So therapy starts according to the patient complaints, not only HRT. There are the non-hormonal treatment is also there. What is non-hormonal treatment? So first, I will just discuss about the non-hormonal, then we'll go to HRT. Because non-hormonal treatment is also very important. What currently we all gynecologists are giving. So we start your day early in the morning. Non-hormonal इसमें first आता है diet therapy, which is very very important. Plenty of antioxidants, plenty of nutritional agents, calcium, proteins. So many things are there that patient need to have in her diet. Okay. Then Another, morning में उठो, योगा करो, मेडिटेशन करो, sunlight ले लो, that is a source of vitamin D. Okay, then plan your breakfast after 40 years, less oil, less sugar, if diabetes, no sugar, and healthy diet. Then exercise, proper exercise, then complete तुम्हारा दिन पूरा फुर्ती से भरा रहना चाहिए. Take help of like groups that we are having our group, we advise them कैसे करना है. Have plenty of friends. So और कुछ तो भी क्रियाशील रहो, कुछ ना कुछ करते रहो. जो हाउसवाइफ है, कुछ तुम्हारे हॉबीज है वो पूरे करो. So this is a holistic approach slightly that we'll cover it also. Then medicine, there's a natural isoflavones, there is a natural phytoestrogens diet. That is why I've been having very good source of the natural phytoestrogens. So such type of diet we advise. Then flax seeds. Flax seeds in the jawas ki chutney, simple jawas ki chutney, which is very important. Even delivery के बाद में जो आड़ियों देते हैं, आड़ियों, what you call is a Marathi में आड़ियों बोलते हैं, which is very like a black sabudana sarka रहता है. It's a very sticky also. So that if she consumes daily, it's a good source of iron and calcium. So even the calcium rich diet, sesame seeds and til में calcium है, राजगिरा में calcium है, then your बाकी जो चीजें हैं, मेथी में calcium है, बादाम में calcium है. तो find out these natural sources of diet, calcium, protein, sprouts में है proteins, green vegetables, iron. So पूरे find out करो, implement that in your diet. So diet is very important. So first simple diet, menopause diet, which is very important. Secondly, the non-hormonal medications that I mentioned you, like we are having some medicines also that we give to the patient. So it will reduce your other cells. See, what's the more common, why she is more worried because of the hot flashes and depression. So that we give non-hormonal treatment, like suppose some neurotonics like gabapentin, preglobulins, like that's, these are the some neural medications that will, क्या बोलते हैं अपन, थोड़ा सा elevate करेंगे mood, hot flashes कम हो जाएंगे इससे. So neurotonics, we can kind of call it neurotonics. So these are the some therapies are there. Then another are the HRT. When we are thinking of HRT, there are very strict guidelines from our society when to start HRT. So this is a very vast topic we cannot discuss in this forum. We can have another time. But see, this is a hormonal therapy. Already I have said that estrogen hormone is not there in our body. They are slowly declining. There are two types of menopause, natural and surgical. Natural means slowly the patient is getting menopause, and so that what is the benefit of this therapy, this natural menopause? This estrogen hormone is in the body till in a very small amount till 60-65 years, so that the patient will have less symptoms. Surgical means directly with some problems you are removing the ovaries also with uterus, or some ovarian tumor and you are removing the ovaries. So that time the patient feels the symptoms more, like hot flashes, then the sweating. In that patients, a non-hormonal we can use, or many times a dryness in the vagina, urogenital symptoms, or the osteoporosis. In such patients, we can think about the HRT, but it has to be very in a judicial way. We have to find it out. We generally try with the non-hormonal therapy, and then we think about the HRT. Even the, just suppose I mentioned about the urogenital dryness or urogenital symptoms, you can apply the simple estrogen cream over your vaginal area. That will be sufficient, but not constantly. Hardly you can apply for 1 or 2 weeks, or you can consult your doctor accordingly, because patient to patient there is a variability. So patient need to seek advice of the doctor, which is very important. Otherwise, you cannot just prescribe in this one like HRT for like these days. You have to evaluate before giving the HRT.
So, ma'am, what are your thoughts on alternative therapies or herbal remedies? To be precise, like what are your thoughts on these options? Like, can they control menopausal symptoms?
See, it comes under these therapies comes under the holistic approach.
Okay.
Okay. So one of the important factor is the diet and the herbal medications. Definitely herbal we see our country is very ancient. We are having very rich ancient culture, and so many medications were there. If you see the previous our grandmas, dadimas, all people, see उनके लिए बहुत सारे symptoms कम रहते हैं. जैसे what we are observed in last 20-25 years. See, these menopausal symptoms are becoming more earlier. That's sweating, hot flashes. It type 2 type personality. So nowadays, what is happening? The career, stress, tension, so many things are there. So that's why even the loneliness, because having so many all facilities are there. So there is no need of struggle. That is also a very important factor. So ये जो symptoms है इसके लिए एक herbal medication भी simple diet plan भी बता सकते हैं. और we can add definitely herbal medicines. I mentioned like flax seeds, evening primrose. All these are the very good medicines. Even serpents, the snake, the snake roots, we call it as a. So see, these are the very simple things that we can herbs we can add in our diet.
Okay, so ma'am, like, are there any other alternative therapies besides this, like diet and herbal remedies, like anything else that might help with reducing the severity of menopausal symptoms?
See, the treatment part already I have covered. Only the simple, it's a non-hormonal and the hormonal.
Okay.
It comes everything. Okay. Then the holistic approach already I covered, from morning to 6 to 10. Meditation, yoga, and everything. You should have a positive things, lot of friends, lot of hobbies. Whatever your hobbies are, you should pursue your hobbies and be happy always, which is very, very important in this 40 plus life. Because see, aging process is continuing, but you have to age gracefully, which is very important. So accordingly, you have to plan. See, what is very important, what message we are using: able, stable, and capable, which is very important. She should be able to do everything, capable of doing everything, and stable. Mental stability is very important. So I think this covers everything. So, and when the holistic approach is very important, positive approach towards life. So it covers complete menopausal pattern.
Like you have like पूरा आपने एक जस्ट हमारे पूरे सेशन का आपने बहुत अच्छे से हमारा एंड करा है. So ma'am, we are done with the questions. Like, thank you ma'am so much for taking your time out for this session.